Bismillahirrahmanirrahim, and good morning to the worthy panelists. My thanks to Ajaz Sab for inviting me. Ajaz Sab is here. Very happy to see the panel here. My talk will be actually looking at, how Pakistan has been responding in collaboration with various international organizations in the times of COVID-19, and how technology has been actually has been a worth investment in terms of making sure that our responses are right on the dot when it is required. Just to give you a brief, background of our work, we are working in Pakistan since 2009 under USAID support. We have been receiving funds, Global Fund and DFID and other organizations. And today's topic is very important in terms of how the international community in times of COVID has been very useful in terms of improving Pakistan's response to the pandemic. So as you know, the first case was actually detected on 26th of February 2020, and that was a time when we realized that when we were not sure, things that will be happening in Pakistan, and we were first, contacted by National Institute of Health to see, that how USAID can be supportive in this response. And the first thing that came to our attention was, that how we can, based on the Wuhan experience from China, it was basically to see how, our procurements vis-a-vis personal protection equipment can be actually monitored, and more visibility should be there so that, we can have that kind of response in terms of availability and access to the whole health system in Pakistan. So I think from our perspective, you will see in this slide, that partnership just started for the reason of our background work. We have been working on supply chain management since 2009, and family planning and maternal and child health and immunization and so many other areas. And Pakistan has been using that platform of Pakistan Logistics Management Information System to bring more visibility to the logistics and supply chain data in the country. So that was a point of entry, and I'm very happy as a Pakistani that on the platform of the USAID funded Global Health Supply Chain, Pakistan, Chemonics, our project Global Health Supply Chain was among the very first responders to meet the requirements of the COVID-19 pandemic actually. So the first thing was, that how not only that we should be able to use technology to monitor procurement and supply chain. As you know, the World Bank and the Asian Development Bank as multilateral partners came in, and almost $336 million support was given to Pakistan. And after the National Security Council, the committee was formed, and I know, in March, early March, all those things were actually, responding in terms of, a rapid response. And also not sure, that how we can actually make sure that we are responding rightly. So Pakistan was doing all that it can, and actually requested, many organizations, including USAID, World Bank, Asian Development Bank, and others, to see that how we can work in a collaborative manner. So I would say, I think the technology partnership has actually paid its great, I would say, impact in terms of how this has transformed the response on COVID-19 in Pakistan. So, as I said, the first thing was, development of a procurement and supply chain management system, real-time information system for the National Disaster Management Authority. And this was to look after all those, coming inflows of monies in Pakistan to monitor how we are looking at purchasing orders, how many orders are given, are there supplies enough for global resourcing. When are they coming? Is there a need of cancelling an order? Are there availabilities from global suppliers? And how we are actually responding to procurement and supply chain management requirements in real time business. So that was the first thing that we did as a procurement and supply chain management system for the National Disaster Management Authority as a topic of the today, the role of the international elections and bodies. So that was it. And then another area was basically to look at, how are we looking and monitoring our points of entries. And points of entries are, our airports, our seaports, our, land ports. And as on the travel, people were coming from China, flights, Afghan border, Turkmen border, and, there was a fear as to make sure that, Pakistan is responding to surveillance of those travelers and passengers coming into Pakistan. And if they have any, any suspects and they have any symptoms, they should be actually screened and quarantined and retained there, in those quarantine centers. So that was again, we worked on this, with the Central Health Establishment. CHE is basically a Ministry of National Health Services body that looks after, the health interventions as an international health regulation, for all passengers coming into Pakistan, seaports, airports, and dryports of Pakistan. So this was another important area that was, as a first responder, we wanted to make sure that how are we monitoring those patients who are coming from outside world, with COVID-19, any infections. So we sat down with, Chi, and the traveler surveillance information system was developed. And I'm very happy to share this with you. In the very earlier times, the first target was to develop the system in just 7 days to monitor, the incoming passengers across the world, into Pakistan actually. Those early times, I remember, quite a pressure. People were trained, at all airports and airports, how to monitor and, how to enter their data in a live system, string of flights. So this was also, I think, very important in terms of how international body collaboration with government of Pakistan has been responding to those kind of requirements which pertain to the international responsiveness, and support to the government. So this system was up and running in 7 days with all those enhancements of the software that we did over the period of time under USAID support. But it monitored initially 1,800 flights, and so far there were about more than a million passengers who were monitored at active airports, and also at Pakistan and border. And this was a very important area in terms of the international response, and the support to the government of Pakistan in difficult times. Then was the PPE equipment. As you know, in the early times, we were not knowing as to how much Pakistan is procuring, how much money is available, and how that money is actually going into different purchase orders and placing those orders internationally, locally. How much is coming? What are the requirements of different hospitals and quarantine centers and treatment centers in Pakistan over the period of time? As this was the COVID-19 pandemic was a brand new epidemic. I mean, we haven't seen this kind of thing in our lifetime. I'm sure the panelists who are sitting here. But I think the most important thing was to make sure that our first responders as healthcare providers, the workers on the front, should be able to get access to PPE equipment and all these important support elements. So personal protection equipment monitoring was very important. And that was another supply chain area that we worked with the government of Pakistan very closely to develop, inventory management system of all those procurements and, support pouring into Pakistan through World Bank or, Asian Development Bank, and also monitoring those as to how much is in the, different stocks and how those stocks are being supplied, across, the country in terms of its availability. So that was, I think, an accelerating response in the initial times. As you know, there was a lot of deficiency in terms of boosters. The industry was not responsive to masks, those were kind of major, deficiencies in Pakistan. And our healthcare providers in hospitals, our industry was not prepared. Our healthcare providers were not, trained. And so it was quite a daunting task in terms of making sure that even, ordinary masks are available to, healthcare providers, and the personal protection equipment is available across different hospitals. Then another important area that came into our attention was Government of Pakistan's requirement as a support from USAID and international partners on forecasting and quantification requirements of PPE. So the first request that I know came in was from the KP government, as they were not knowing how much of personal protection equipment is required their designated COVID hospitals actually. And what does it mean in terms of a community response required to meet those requirements? So we sat down with the government. We actually reviewed all the international literature on how to respond, Ebola or others, and what does it mean in terms of dealing with such an, pandemic, and what does it mean in terms of making sure that we are forecast and quantification, which should be aligned with the industrial, production requirements, are actually are being quantified, in an appropriate manner. So this was done. We developed this, forecasting and quantification calculator for Pakistan. This was first calculator developed in the world, and I'm very happy, that this international coordination with the government of Pakistan actually, brought, good, feathers in the cap of Pakistan's development work, where Pakistan's, forecasting and quantification calculator was not only used by international community like UNICEF or WHO, but it was actually, adapted by I+ Solutions, Netherlands, and they used it and developed it as a online training module. And then, more than 550 people were trained across the world from Pakistani forecasting, calculator. So this was the development. Not only that, we were able to quantify PPE requirements. I know that Dr. Zafar Mirza, in those times, he was minister and Prime Minister, worked very closely with him and the National Institute of Health and, of course, NDMA and NCOC. So, all this important tool was very important from a technological, perspective, that it enabled Pakistan to quantify its PPE requirements for the entire, country. And then another was, this SIN training, LMIs on COVID-19. This was another requirement that came in as to see that, a supply chain for the healthcare providers, and how many people are being trained on COVID-19, where they are, what kind of, specific trainings they are getting, and what does it mean in terms of their, usage across the province. So this was another system where we were trying to inventorize, Pakistani critical mass of healthcare providers as to what, systems they are being trained on COVID-19, and what does it mean in terms of pandemic response in the country. So I think this digital coordination, making sure it's a multi, stakeholder responsiveness, where you have, World Bank and Asian Development Bank as multilateral partners of Pakistan, giving almost, $350 billion loan to make sure that we are able to procure what is required to meet the requirements of surveillance and, personal protection equipment, and making sure that our frontline healthcare providers are safe and healthy that they are providing. But yet it was an emerging response, and we actually faced many challenges. And, when how many doctors died, initially when we were not able to do as much, not give as much responsiveness as it was required. So I would say, I think, international bodies, they have a big role. I know that, foreign policies may be messy in terms of international relationship and regional and global relationship, but at the same time, those agencies and development partners, from UK, US, and other parts of the world, like Europe as well, and multilateral organizations, they tend to play a very important role in countries like, Pakistan, where there's a population of 2 million people, and, there were increasing, rates of infection. We were not able to meet the requirements of personal protection equipment. And then somehow the digitization of the health sector vis-a-vis supply chain management and personal protection equipment actually proved, a very good partnership with different corporations. This is my last slide, and I think it is very important to also underscore the importance of private sector and industry to connect, your response to a pandemic like COVID-19, and what does it mean in terms of their support. So the second part that we did was, government of Pakistan actually identified 74 facilities of providing, critical care. And this critical care was actually assessed. We identified very quickly biomedical partners in Pakistan who are able, biomedical scientists and engineers, biomedical engineers, who can actually see, for example, the oxygen ecosystem and their supplies, as to how different hospitals are managing, because oxygen was one commodity that was looked as a very precious commodity in the times of COVID. And it was very important for, development partners and government of Pakistan to make sure that supply chain of the oxygen is appropriate where it is required actually. So with this, emerging and accelerating response against, COVID in Pakistan, we were able to very quickly engage, a couple of partners from the, private sector, to do quick assessment of the health facilities in Pakistan. Using, transportation facilities from PCS and Artema. Artema is basically a biomedical partner that who's, they are very much engaged into biomedical training and supplies of ventilators in Pakistan and around the world. We engaged them to train almost 500, more than 539, health staff in Pakistan who had to use the 200, made in USA ventilators that US government actually donated to Pakistan. And this was after, collegial, coordination between Prime Minister Imran Khan and Donald Trump when they spoke on the phone, and it was agreed that 200 ventilators will be supplied to Pakistan. So I would say, in a nutshell, that the international responsiveness to pandemic like COVID-19 has been extraordinary. Not only that, multilateral partners like World Bank and Asian Development Bank are contributing, $200 million loan to Pakistan. It quickly enabled Pakistan to buy what is required to meet the requirement of commodities in the country. But at the same time, this humanitarian assistance where we are trying to bring, those ventilators to Pakistan and increasing Pakistan's, critical capacity to almost 30% more as compared to what it was very important, contribution from, partners like USAID. And at the same time, ministers, I know Dr. Yasmin and others, and, our council generals from, US consulates across the country, Ambassador Paul John, from the US Embassy. They were all involved very, closely in monitoring this support and also making sure that, this is timely support to the government of Pakistan in responding against COVID-19. So I think this is what I wanted to speak, that in times of difficulties, in times of, public health challenges, the practices that are required as, public health logisticians and supply chain experts or technology experts or experts from, industry is something that you have to make sure that it is combined and collective response of the entire spectrum of, people from health industry, production industry, biomedical industry, and of course healthcare providers, in support with the government of Pakistan and international communities bring together something which is responding to the needs of the people and making sure that we are able to save lives as much as we can. Thank you so much, Jasab. There will be questions. I'm very happy.